Well, hello everyone. This is part two of substance abuse groups. Wanda Jewell. This part I want to talk to you about multifamily groups, and I particularly want to tell you about multifamily groups because it's an excellent way of helping family members to communicate and restructure their family system. We at GADS and many other facilities, the staff asks patients or clients or people who are in treatment to bring in family members for three reasons, basically. Number one, an addict alcoholic is much more likely to stay clean and sober over the long run if they have a family member, one or more, in treatment with them. Second, addicts and alcoholics tend to be quite manipulative. We are charming, can talk you out of whatever money you have in your pocket with an urgent need. And so if families come to treatment and get themselves educated, they're much less likely to be manipulated. And third is that we know that family members have been through hell with the difficulties of having a family member in an active user of drugs or alcohol. So we invite family members to come for their own healing. We also encourage family members to read. We have a reading list. And also to go to Al-Anon, which is a way to help a person learn about the disease of alcoholism and drug addiction, to learn the 3 C's, which Al-Anon teaches, which is you did not cause it, you can't control it, and you can't cure it. And in Al-Anon, a person can learn how to set boundaries, not ultimatums, but boundaries, so that they are no longer involved in the disease. And that in itself will help restructure the family. Running a multifamily group is exciting and kind of scary. It's been described as 4-wall handball with 8 balls in the air at the same time. And as group leader, it's good to have a co-leader. As group leader, you're monitoring all of that at the same time. Again, I like to start with a check-in. And since I'm at GADS only once a week or twice a week, I don't really know the people or what's happened. Or where they are in treatment or what's happened with them in family group. So in the check-in, I ask people, after I've said the statement of purpose and my role and the ground rules, which include, I encourage them to speak in I statements, which is I feel, I think, rather than let me tell you what you did wrong. I try to trim from the beginning any kind of blaming, shaming, criticism. So after I make that statement of purpose, I'll ask the group to go around and have each person say their name, who they're related to in the room, how they're feeling about being here, and what has been their experience at GADS, particularly in multifamily group. And so as they're checking in, and I get a sense of where they are, who's done some work and who, definitely needs some work. The healing factor of that group, or the therapeutic factor, is the universality. You can see it on people's faces, as I said in the previous video. And there's nothing like that feeling when people see themselves in others and they relax a bit. They may say something about it, and it gives them possibilities. It gives them strength and ability. And Satir was all about the possibilities in people and in families, and it's really fun to see that happen in the family group. A word about Minuchin and Satir. Minuchin said in one sentence, Salvador Minuchin, he's 96 years old, maybe 97. I think maybe he stopped teaching. But he said that in a conference where I saw him, he said that he could teach us everything he knows about family therapy in an hour. And it involves a lot of looking at your shoes while people are talking to each other. But he said that all problems in the family come from either the over-involvement or the under-involvement of its members. Now just, think about that for a moment. He summarized all the problems in families. That all the problems in families come from either the over-involvement or under-involvement of its members. And you see that in families in the group, that people are overly involved with the addict and taking care of things for that person and cleaning up the debris that they have caused, and really being codependent and enabling. Not enabling the person, but enabling the disease process. Because if you take the responsibilities away from someone and you take care of them, then you're allowing them to do whatever they please, which, you know, often means drinking and using and being progressively irresponsible. You know, so the satir model is basically sitting, you know, having people sit face to face, eye to eye, and talk with each other. When I first heard that model, I thought, well, duh, you know, that's, but then you look around and you realize that families don't do that, particularly families where there's that disease process present. So again, you think of it as a single session group. You're very active in the beginning, you're very active in the end, and your moving group, and during the middle, you're going. Usually at GADS, what we do is go family by family and give each person who's there with family members a chance to communicate with them. And so our model is we do the setting the structure and the check-in, and then we'll ask, does anybody have treatment plans? Because what has happened with many of the patients is that they've been required to write a letter to a family member, read it in a peer process group, get feedback, get it approved by the counselor, and then bring it into family group and read that letter to the family member who is present. So if you have treatment plans, then you start with that. If not, you see who needs to start, who wants to start. And then you go family by family. Each family has a chance to communicate. I like to move them into the center of the circle so that they're arm's length from each other. But almost nobody but me likes that, particularly the people in the group. That's just too hard for them to do. So we sit in the circle. They sit across from their family members so that when they're communicating, they can look directly at their family member. I watch for, and you know, you should watch for any kind of enabling or codependent behavior. You want to interrupt any blaming, shaming, or criticism, and help redirect that. And then give each family a chance to communicate with each other, and then when they're ready to get some feedback from the rest of the group, and that's where I might ask a question, or the co-leader might, or peers, because the peers, the other patients, they've been in group together quite a lot, and they know each other really well. And you know, here is an essential component of any group, that if you facilitate people talking to each other, the things they say to each other are far more valuable and carry much more weight than if you said the same thing as a group leader. And then if someone doesn't say what I think needs to be said in the feedback, then I'll say something. And always with that absolute respect, a good-natured sense of humor, and referring again and again to our shared experience. You want to manage discord. We had one couple that I'm certain that she was a disorganized personality and probably met the criteria for borderline. She was the patient, and her husband, I'm sure, looking back on it, was passive-aggressive, and they tried to communicate in the group, and within about 2 minutes, they were yelling at each other. So we stopped them, the co-leader and I stopped them, and had them return to the group and asked them if they wanted to stay after, because I could see that, you know, what they had to say to each other was quite volatile. She was not happy about that. She threw the chair, and not very far, but, you know, at least she sat down and was calm. Because you want to, you know, it makes me anxious even talking to you about it, because, you know, you want to manage those things in group in a way that everybody at all times feels safe. So you want to manage that discord. You know, watch for the enabling codependency behavior. Interrupt any blaming and shaming. And I'll tell you the major measure for me of success in a group is that you ended up with the same number of people that you started with, and that everyone survived, including you. So those are my comments on multifamily group. Enjoy the group work. There's nothing better to make you feel alive and useful is doing substance abuse groups, particularly multifamily group. Email me if you have questions or comments, and thanks again to Professor Whitsett for asking me to talk to you.